There is a lot of hype right now about these things, red light devices. I got this mask from my friend, but I haven't really been brave enough to try it yet. And social media is all over these kinds of devices. There are some really bold claims out there about how red light can impact your health. Things like decreasing inflammation, improving vision, or even treating nerve damage. And to me, this was all sounding a little bit like pseudoscience at first. And I'm not the only one.
When I first heard about this therapy, I laughed at it.
That's John, a researcher I spoke to who now spends his time studying the impact of red and near-infrared light on health. And he's not alone.
We've got people associated with traumatic brain injury, stroke, depression, Lewy body disease, Alzheimer's disease, all interested in using this treatment to stave off and help their patients.
Research is starting to show that long wavelength light does have some legitimate physiological effects, some of which you can even demonstrate with a quick eye test. H-E. But does all of this mean that devices like these are scientifically backed?
They're being used because they're low power. They're not going to hurt you, but will it help you? It's probably just a waste of money for a lot of them.
Where does the science meet the hype? And I want to know, if it's true that certain types of light do affect our health, then what should we be doing about it? This is John Mitrofanis, a neuroscientist at the University of Grenoble-Alpes in France.
I was having coffee with a colleague about 20 years ago, and he said to me, I found this new method that can be neuroprotective, that can save cells from distress. And I said to him, what is it? And he goes, red light treatment, and I laughed at him.
But in the 20 years since, John has done extensive research on this topic, in particular looking at the impact of red light on the brain.
There's a wealth of data. It's been shown to be positive in animal models of Alzheimer's disease, Parkinson's disease, and aging.
So this isn't just vague claims about healthier skin. This is something that could have an impact on a serious neurological condition. But let's back up a little bit. What exactly is red light therapy?
It is specific, very specific wavelengths of light that can be used to stimulate cells. And cells have receptors for this wavelength of light. And if that cell is in distress, that light will help that cell make more energy and, in essence, be healthier.
Exactly how this works isn't completely understood, but a key element is that longer wavelengths of light can penetrate through skin and other tissue and reach the mitochondria, those organelles in many of our cells that make energy.
So anything that the cell wants to make or drive or activity or anything like that, that mitochondria provides the energy for that to happen. The light will stimulate the mitochondria to make more energy. Now, if that cell is sick, then goodness me, the more energy it has, then the better chance it has to stave off any kind of dysfunction or any kind of insult. So that's short term. So we've got the mitochondria going brrr, and they're making the energy. Thank you very much. I've got more things to survive. It's not only short term, but that leads to long-term changes as well because it changes the gene expression. I think there's up to 100 genes their expression's been changed.
This idea about the effect of light on mitochondria and thus on wider physiology is known more technically as photobiomodulation. And it's not a completely new idea, but there has been a recent boom in research on this topic.
Really, the father of photobiomodulation, so to speak, is Andre Mester, and he was in the 60s. He used it for wound healing, and really it's kicked off since then. There's been a lot of more studies looking at the actual mechanisms involved, a lot of clinical stuff. And the last 5 years, it's just got crazy.
Photobiomodulation is a huge and kind of messy field. Different experiments use different wavelengths of light, different amounts and intensities of light. They're targeting different parts of the body, and some are looking at treating specific diseases, while others are considering more general health. Glenn Jeffrey at University College London in the UK is interested in the impact of the light that's all around us in our daily lives. So I paid him a visit to find out more.
I've just put the spectrometer up against the window and looked out at the world. That's daylight here. and it goes out to 950 nanometers. Infrared light goes out to 2 to 3,000.
Oh, wow.
So we've only got a limited shot of this, but there's broad spectrum light coming out through the window.
Okay, got it. Glenn let me play around with this infrared camera to look around at the office and the world outside.
This is an old building. It's a cheap building. They've made no attempt to block infrared light.
It's like a bright white that I'm seeing on here.
And if you use it to look at a plant, you'll see an enormous amount of IR reflection in the image, because plants reflect infrared light.
Oh, wow. Yeah, it's really quite bright. Next, we tried the spectrometer on the ceiling lights.
This is a spectrum of light from the fluorescent tubes above us. There's almost no infrared, and it's all spiky. It's a series of spikes that your eye puts together and sees as white light.
That looks so different.
It's nothing like daylight. Now, your eye tells you it's pretty similar. It is absolutely nothing like.
It's really stingy. Glenn is interested in the fact that most of us with office jobs spend way more of our life now under narrow spectrum artificial light than we do in sunlight.
Do you work in an office environment?
I do, 2 days a week, and then the rest of the week at home.
Okay, and what's the lighting like environment in your office environment?
Yeah, the office has windows, but also LED overhead lighting.
Right, and how many hours a day do you spend when you're actually in work?
8 hours a day?
And are you in front of a screen all the time?
Yes, probably
Okay.
8 to 10 hours a day.
Okay, if you're in a modern building, you probably have a shortage of infrared light. You've almost certainly got LED lighting that's got no infrared in it at all. So you're a great candidate for improving your vision.
Great. Glenn's research involves experiments that show the effect of red light exposure on color vision, and offered to demonstrate on me.
So this is a chroma test. It is a test of your detection of colours. So I'm going to put some coloured letters on the screen, and your task is just to identify them.
P, V, U. His team's experiments showed that just 3 minutes of low-level red light exposure on the eyes improved vision. So I put on some funky glasses. Do I look cool?
You look extremely good, yes.
Do I keep my eyes open or closed?
It really doesn't matter too much because the longer wavelengths pass through the lid.
Then it was time for another eye test. H, D, E. And finally, time to check the results.
So if we're looking at red, before we kicked off, the percentage contrast on the letter you could see is about 1.5, 1.2, something like that. Afterwards, it's well below 1. Okay, so you're scoring 0.5, 0.6, 0.7, you got 1. So your ability to detect red threshold has come down. Down is good. Let's look at the blues. We kicked off with an average, I would say, about 2.5 to 2.8. We've got you down to about 2.2 to about 2.1.
Wow. This matched Glenn's previous findings, and once again, it's all about the mitochondria.
Your retina is the most energy demanding part of your body.
Really?
You have more mitochondria in your outer retina than anywhere else.
Whoa. Modern commercial buildings often have infrared blocking layers in their windows, and Glenn thinks this is an issue for public health. He's campaigning for wider wavelengths in internal lighting, especially in places like schools, hospitals, and nursing homes. He says exposure to even low levels could have effects on preventing or improving outcomes for a whole range of conditions. But there is a lot of debate in this field, and not everyone is on the same page.
I know light from the sun has been used as a treatment for many, many years, but the amount of therapeutic light we get, and I'm not talking about visual system here. Remember, this is light being absorbed through your body and then affecting a molecule that can absorb light within your body. The dosage, the amount of those specific wavelengths that are hitting our body are really suboptimal to do anything. So I'm not a proponent of this stand in the light.
This is Juanita Anders, a neuroscientist at the Uniformed Services University in the US. And her work focuses on very high-powered red light and how this can be used in a narrow, targeted way to treat localized problems.
I looked at the literature and I came across red light therapy. And when I looked at the experiments, they were all pretty bad, uncontrolled. And I thought I could do a much better experiment than that. And so I looked at facial nerve injury and repair, and I was able to increase rates of regeneration. And I was hooked at that time. In my case, in the last 5 years, I've been using light to suppress pain, using very high powers, high wattages, high irradiances, with light put directly on nerves. And we have shown in the last 4 years that we could selectively block transmission of pain in pain fibers.
This work is a very far cry from the idea of changing a light bulb or just spending more time in sunlight.
Since we have to use high power, we deliver lights through a fiber optic and a needle directly to the nerve.
Perhaps unsurprisingly, Juanita's pretty skeptical of a lot of the low-intensity red light therapy devices out there.
Since the development of LEDs, they're very cheap. You could put them in all kinds of formats. And so there's been this explosion of devices for you name anything. Put lights in your shoes, wrap it on you. But the problem in the field as a whole is that most of these devices have never actually done any research to see if their device is effective.
The devices currently on the market today are generally low power enough that they're not going to burn you if you hold them in one place for too long. But Juanita says that a much higher intensity is actually what makes red light therapy effective, at least for a lot of the medical treatments that her research is looking into.
They'll all say the same thing. Oh, light can change inflammation. Light can cause cell proliferation. Light can increase collagen. But their device was never tested. And most of these devices, because of FDA restrictions and safety, are suboptimal. They don't have enough power to really do what they need to do.
But despite this strong skepticism, Juanita does occasionally use red light on herself.
I have a therapeutic laser with combination wavelengths of 810 and 980, and it's pretty high power. And I know if I want to treat deep muscle pain or back pain, I've treated myself, but it's not something I can recommend someone else to do. It's based on my knowledge of the wavelengths. It is very successful.
And John agrees that wavelength and dose are key factors when it comes to home devices.
Some are better quality than others. Don't buy something that's just an LED covered with a bit of red tape or something. Check the wavelengths, and if it's upwards around about 670, round about there, through to the near infrared 800s, up to 1,000, then you're in the right range.
And John is also convinced enough by his results to be trying red light therapy himself.
I mean, I use the helmet device every day. Some exciting results that we've got of late is that using the helmet, and this is very early result, that it seems to turn an aged brain function look like a younger one. Because of that early finding, I'm certainly using it. I'm being more vigilant to use it every day.
Different researchers have different ideas on the best way to use red light therapy and its most useful benefits. But there does seem to be a shared hope that this kind of surprising treatment could be used to really improve people's health. So, what's next?
The important thing is to get proper clinical trials with proper controls. The field has been lacking that for since the inception. And in terms of mechanisms, we've still got to work out the right dose, and we're working on that. And by the time I die, I'm hoping that light will be part of the discussion.
In the pain world, I would really like to see it replace pharmaceuticals for pain control. I would like to see it be a very effective transcranial treatment for depression and for diseases, neurodegenerative diseases like Parkinson's and Huntington's. I think that these hard problems are where this field could really find an important place in our medical system.
What remains to be seen is whether the progress in this field is helped or hindered by the current hype around commercial red light therapy devices.
And what I'm really concerned about is what it does to this field as being respected and approved, especially for the hard things. You want to treat Parkinson's, and we have all these devices out there.
There are strong and differing opinions, even among the researchers that I spoke to. So where does that leave this? Now, I'm relatively confident that it's not going to do me any harm, and it might be quite relaxing, if nothing else. But I don't think I'm going to be spending my time or my money on expensive products or treatments anytime soon. I am, however, excited to see the results from more robust clinical trials that will really put red light therapy and its impacts to the test. I mean, maybe I'll just give it a quick try, you know? Oh. I actually don't think it works. It won't stay on.